Hi, I'm Khlood, and I'll be talking about Q fever. Q fever is an infectious disease caused by bacteria. It primarily affects humans and some animals, often presenting as flu-like symptoms. Coxiella burnetii is the agent that causes this, and it's a type of bacteria. It's highly resilient and can survive in harsh environments outside the host. Q fever is primarily transmitted indirectly, meaning humans don't usually get it through direct contact with other infected humans. The bacteria can become airborne. Tiny particles can linger in the air, especially near farms or areas with infected animals. The bacteria are released primarily through birthing products of infected animals. Also, urine, feces, milk of affected animals can also carry the bacteria. Humans most commonly become infected by inhaling contaminated dust or aerosols. Even handling contaminated materials or being near breathing animals can pose a risk. So, no direct human to human transmission is typical. Exposure usually comes from animals or contaminated environments. In 2019, there were 173 acute cases and 34 chronic cases reported in the US. Acute cases are more common, while chronic cases are less frequent but are more severe. About 6.2 million US adults show evidence of past exposure to Coxiella burnetii. Many infections go unnoticed because they can be mild or asymptomatic. Morbidity is generally low, less than 5%, and mortality is also low, typically 1 to 2%, but chronic infections can be more severe. While Q fever is relatively rare and usually mild, it spreads exposure and potential for serious chronic illness, making it an important public health concern. Signs of this would be fevers, chills, cough, or chest pain, also fatigue, headache, muscle aches, nausea, vomiting, or diarrhea for symptoms. The incubation period is typically 2 to 3 weeks after the exposure to the agents. And treatment would be for the acute fever would be antibiotic doxycycline or chronic with antibiotic therapy. So people who work closely with animals, such as farmers, veterinarians, are higher at risk. Living or working near farms or areas with livestock can increase exposure. Pre-existing conditions like individuals with heart valve problems or weakened immune systems or immunocompromised as well. And older adults tend to be higher risk for complications. Males are slightly more likely to be affected than females as well. And again, just touching on the age, usually typically around 60 to 69-year-old, mostly male, and mainly white or Caucasian people, Black people, or African Americans. So family members can become affected if exposed to the same contaminated environment. Close living conditions or shared occupational exposures may contribute as well. Genetically, certain genetic factors like the HLA-DRB104 allele may increase susceptibility to the Q fever. Infection can also have psychological consequences, including anxiety or depression, especially in chronic cases. For the marital status, there was no research that showed that there was influence for this outcome. So the social determinants that can increase exposure or risk include the occupation, socioeconomic status, education, healthcare access, living conditions, and determinants that increase exposure or risk are farming practices and airborne spread and geographic and regional factors. So the CDC in 2024 listed these as disparities for the Q fever. As I mentioned before, occupational, demographic, race and ethnicity, gender, and health accessibility. Additional variables could be screening testing, um, serology detects antibodies indicating past or current infection. PCR or polymerase chain reaction identifies the presence of Coxiella burnetii DNA useful for early detection. Vaccinations, there's only QVax. It's an Australian vaccine for people at high risk of Q fever. Vaccination is recommended primarily for individuals with occupational exposure. Um, Studies show that community exposure can be broader than occupational exposure, meaning people outside high risk jobs can still be at risk. And then qualitatively, outbreak investigations indicate that Q fever often originates from indirect transmission or environmental contamination, such as dust or aerosols from infected animals. Both types of the data highlighted are the importance of considering environmental and community factors, not just occupational exposure, and preventing Q fever. The gaps in the knowledge that we don't have are that these drugs are targeting the host cells um, to inhibit the growth of Coxiella burnetii. They represent a novel approach beyond traditional antibiotics, and that's what we would target with the host-directed antimicrobial drugs. While venlafaxine is a newer antimicrobial shown to reduce clinical signs of Q fever in infected patients, and it offers an alternative for cases where standard treatments might be less effective. So, ongoing research is expanding treatment options aiming to improve the outcomes and reduce symptoms in Q fever patients. Vaccine strategies would be creating newer and safer vaccines. Although there is a Q fever vaccine in Australia, it's not as safe, and that's why it's not implemented in the US. And we need to do this so the high risk populations can have that vaccine. We also need to strengthen reporting to reduce underdiagnosis, enhancing surveillance systems, and many asymptomatic. So that means like a lot of them are go undetected or even get mistaken for the flu as well. So just honing down on that diagnosis. So TNGs are targeted next generation sequencing. It's a modern diagnostic method that can detect Coxiella burnetii more quickly and accurately than traditional tests. Potential benefits of early diagnosis enables earlier treatment, which can improve the patient's outcome, and it may help reduce morbidity and mortality associated with Q fever. TNGSs represent a promising tool for timely detection, which is crucial in managing and controlling Q fever outbreaks. And the core components of implementation could include vaccine efforts, including research, occupational and environmental controls, awareness, and education. And we hope that the outcomes would be reducing the incidence of Q fever and having higher wellness levels as well. Here are my references, and thank you.